to that. Of course, in recent weeks, many people living with heart disease and stroke have had their non-emergency surgeries or regular medical appointments canceled or postponed due to COVID-19. But once doctors say it's safe to resume those procedures, people with underlying conditions may still have some concerns. Now, to help us clear through the confusion, we're joined by the American Heart Association's Chief Science and Medical Officer, Dr. Muriel Jessup. Dr. Jessup, thank you so much for joining us this morning. Let's get right to it. Have people been at risk because their regularly scheduled doctor's appointments or planned procedures have been canceled or delayed?
Well, I think doctors have carefully evaluated whether any of these procedures can be delayed. It turns out that at least 2 out of every 5 Americans have either delayed or canceled their appointments, let alone their non-emergency procedures. So it's time now to reevaluate, and patients should be calling their physicians and say, when am I due to come in?
And I guess the question that folks would have if they've canceled them is it safe for people living with, and we'll be specific here, heart disease and stroke, cardiovascular disease, is it safe for them to go to their doctors for their appointments and non-emergency procedures?
First off, you should call your doctor or the hospital where the procedure will be done so that you understand completely what they've done to make it safe. Many hospitals and offices have changed the seating, changed the check-in procedures. They've done everything to make it safe. So yes, it's time and it's safe. It doesn't mean you can stop wearing a mask, don't touch your face, washing your hands, social distancing.
So they should keep doing all the things that we're doing outside right now. Tell us a little bit about what the American Heart Association is doing to help patients and providers as non-emergency appointments and surgeries get underway.
The American Heart Association is here to help. We have a call-in number, 1-800-AHA-USA1, if you have any questions, and our website, www.heart.org, to provide all kinds of guidance about what to do for your non-emergency procedures. And we're there to help with all kinds of issues.
Now, people have been canceling their appointments, as we mentioned, and emergency room physicians were saying, hey, where are all the patients? Does this surprise you that people are not showing up at the emergency room like they had been prior to the COVID-19 pandemic? And where are all these patients?
It surprises me and alarms me. Every 40 seconds, one American has a heart attack and another has a stroke. And yet the numbers of heart attacks and strokes has decreased in this country somewhere between 30 and 50%. So people are staying home and suffering through their symptoms.
Wow.
And that's dangerous.
So you believe there are people at home right now suffering with reduced blood flow to the heart or reduced blood flow to the brain and just not going to get the help they need?
And absolutely. And time is heart muscle and time is brain.
Wow.
So people can't afford to do that.
Dr. Muriel Jessup with the American Heart Association, thank you so much for joining us this morning. And of course, if folks want more information, where can they go to find more about heart disease and cardiovascular disease?
Yes, www.heart.org or our telephone number 1-800-AHA-USA1.
All right.
Thank you.
Thank you so much for joining us.